Morning. Thank you for the opportunity to present my organizational analysis of St. Luke's University Health Network. Throughout this presentation, I will summarize my assessment of the network's strategic initiatives, organizational structure, and value-based care strategies. I will conclude with 3 evidence-based recommendations designed to strengthen the organizational agility, improve patient outcomes, and enhance workforce stability and support the network's long-term financial sustainability. St. Luke's University Health Network is one of Pennsylvania's largest integrated healthcare systems and has established a strong reputation for delivering high-quality, patient-centered care. However, healthcare organizations continue to face increasing workforce shortages, financial pressures, and expanding value-based reimbursement models. The American Hospital Association in 2025 identifies workforce challenges, financial sustainability, and value-based care as major strategic priorities requiring organizations to improve operational efficiency, strengthen workforce resilience, and expand care beyond the traditional hospital setting. Similarly, the American College of Healthcare Executives in 2024 reported that workforce shortages remain the top concern of healthcare executives, followed by financial pressure and behavioral health challenges. These trends highlight the need for St. Luke's to strengthen collaboration, invest in workforce development, and expand community partnerships. The recommendations presented today are designed to improve access, quality, and cost effectiveness while positioning the organization for long-term success in an evolving healthcare environment. St. Luke's has served the region for more than 150 years and has grown into one of the largest nonprofit integrated healthcare systems in Pennsylvania. Today, the network includes 16 hospitals and more than 350 outpatient care sites throughout Pennsylvania and western New Jersey. The Bethlehem campus serves as the flagship hospital and is designated as a Level 1 trauma center, providing advanced emergency and specialty care. St. Luke's has built a strong reputation for clinical excellence, innovation, and community engagement while remaining committed to delivering safe, high-quality, patient-centered, and cost-effective care. Although St. Luke's continues to deliver high-quality care, several organizational barriers affect its ability to achieve strategic objectives. From an access perspective, emergency department overcrowding, workforce shortages, and increasing patient demand contribute to longer wait times, delayed access to care, and higher rates of patients leaving without being seen. From a quality perspective, maintaining consistent care coordination, standardizing evidence-based practices, and sustaining high patient safety performance across 16 hospitals and more than 350 outpatient locations remain ongoing priorities. Financially, rising labor expenses, value-based reimbursement, and shared risk contracting require the organization to improve outcomes while carefully managing costs. These barriers directly influence multiple organizational performance measures, including emergency department wait times, patient satisfaction, hospital readmissions, workforce turnover, operating margin, and total cost of care. Successfully addressing these challenges will require stronger interdisciplinary collaboration, workforce investment, and expanding community partnerships. The St. Luke's network utilizes an integrated metrics organizational structure that combines centralized leadership with interdisciplinary collaboration across hospitals, service lines, and outpatient facilities. This structure supports the organization's strategic goals by promoting collaboration, resource sharing, and standardized clinical practices throughout the network. However, as the network continues to grow, the complexity of multiple leadership levels and service lines can slow communication, delay decision-making, and create variation in practice across facilities. To successfully implement the proposed strategies, the organizational structure should evolve by expanding team steps throughout the network, strengthening shared governance, increasing cross-functional collaboration, and further standardizing evidence-based practice across all campuses. These enhancements build upon the organization's existing structure rather than requiring a complete redesign, making implementation both practical and financially feasible while supporting greater organizational agility, responsiveness, and quality improvement. Value-based purchasing shifts reimbursement from the traditional fee-for-service model to one that rewards organizations for delivering high-quality, efficient care. Under this model, hospitals are evaluated on clinical outcomes, patient experience, patient safety, and resource utilization. Stronger performance can increase Medicare reimbursement, while poor performance may reduce payments. For St. Luke's, improving quality metrics through standardized care, stronger teamwork, and better care coordination supports both patient outcomes and financial performance. Research also demonstrates financial value of quality improvement initiatives. Revere in 2024 found that organizations implementing value-based quality improvement strategies achieved measurable reductions in avoidable utilization and improved overall organizational performance. These findings suggest that investments in evidence-based practices can improve patient outcomes while strengthening financial sustainability. For St. Luke's, expanding team steps, strengthening workforce development, and improving community partnerships can help improve quality scores, reduce unnecessary utilization, and maximize reimbursement under value-based purchasing models. Shared risk reimbursement models align financial incentives between healthcare organizations and payers by rewarding high-quality, cost-effective care while holding organizations accountable for excessive spending. Unlike fee-for-service reimbursement, these arrangements allow providers to share in savings when spending remains below established benchmarks while maintaining quality standards. Conversely, organizations may incur financial losses if costs exceed targets or quality measures decline. For St. Luke's, success under shared risk contracts depend on reducing avoidable emergency department visits, hospital readmissions, and unnecessarily utilizations while improving chronic disease management and preventive care. Evidence indicates that organizations participating in well-designed shared risk arrangements can improve care coordination and lower the total cost of care without compromising quality. These models reinforce the importance of interdisciplinary teamwork, workforce engagement, and community partnership, as improvements in these areas contribute to stronger clinical outcomes and greater financial sustainability. While implementation requires investments in staff education, care coordination, and performance monitoring, these investments support long-term organizational success by improving patient outcomes and supporting St. Luke's to earn shared savings while reducing financial risk. I recommend expanding team steps throughout St. Luke's University Health Network to strengthen interdisciplinary communication and improve patient safety. Team Steps is an evidence-based teamwork framework developed by the Agency for Healthcare Research and Quality that standardizes communication, leadership, mutual support, and situational monitoring across healthcare teams. This recommendation is supported by strong empirical evidence. SHI in 2024 evaluated Team Steps implementation in perioperative settings and found statistically significant improvements in teamwork, communication, and patient safety. The intervention was also associated with reductions in perioperative mortality and blood transfusion, demonstrating that improved communication can lead to measurable clinical outcomes. Hassan in 2024 conducted a quasi-experimental study involving 132 newly graduated nurses and found statistically significant improvements in teamwork perceptions, communication, and patient safety culture following Team Steps training, p less than 0.001. These findings suggest that structured teamwork training can rapidly improve collaboration among clinical staff. Expanding Team Steps across the network is operationally feasible because St. Luke's already uses the framework in portions of the organization. Building on the existing education programs and integrating Team Steps into orientation, annual competencies, and leadership development would require modest additional resources while supporting value-based purchasing goals, reducing preventable errors, and strengthening organizational performance. Workforce shortages remain one of the greatest challenges facing healthcare organizations and directly affect patient safety, access to care, and financial performance. I recommend that St. Luke strengthen workforce development by expanding leadership development programs, formal mentorship opportunities, career advancement pathways, and employee well-being initiatives. These strategies support recruitment while improving long-term retention of experienced staff. This recommendation is supported by strong empirical evidence. Aiken in 2023 studied more than 21,000 nurses and physicians across 60 magnet hospitals and found that healthier work environments were associated with significantly lower burnout, higher job satisfaction, and reduced intent to leave. Organizations with supportive leadership and adequate staffing also demonstrated better patient outcomes and higher quality of care. Additional evidence comes from Kippleton in 2024, whose umbrella review synthesized findings from 14 systematic reviews representing 674 primary studies. The review concluded that leadership support, professional development, recognition programs, and positive organizational culture consistently improve workforce retention and employee engagement across healthcare settings. For St. Luke's, expanding workforce development is both practical and achievable because many leadership and mentor structures already exist. Building upon these programs requires fewer resources than recruiting and onboarding replacement staff, making retention a cost-saving strategy. Improving retention also supports value-based purchasing by promoting continuity of care, improving patient satisfaction, and reducing turnover-related costs. My third recommendation is to expand St. Luke's Community Partnership to improve population health and address preventable health conditions before they require emergency or inpatient care. Collaborating with primary care providers, public health agencies, schools, and community organizations can improve access to preventive services while reducing unnecessary emergency department utilization and hospital admissions. This recommendation is supported by strong empirical evidence. Zaman in 2024 conducted a randomized controlled trial evaluating community health worker interventions and found that participants receiving community-based support demonstrated significantly higher completion of preventive screenings and follow-up referrals than those receiving traditional care. These findings demonstrate that community partnerships can improve access to care and encourage earlier intervention. Smith and Washburn in 2025 found that structured community-based chronic disease management programs produced measurable improvements in hemoglobin A1C, blood pressure, and body weight among participants. These improvements reduce the likelihood of preventable complications and costly hospitalizations while supporting better long-term health outcomes. Expanding community partnerships is a feasible strategy for St. Luke's because the network already maintains relationships with community providers and outreach programs. Building upon these existing partnerships requires fewer resources than developing entirely new programs while supporting value-based purchasing and shared risk reimbursement models. By improving preventive care and chronic disease management, St. Luke's can enhance patient outcomes, reduce avoidable utilization, and strengthen its financial performance. Successful implementation requires continuous performance monitoring using objective, measurable outcomes. These metrics align directly with St. Luke's strategic goals and support ongoing evaluation of quality, access, cost-effectiveness, and workforce stability. Access will be measured through emergency department wait times and the percentages of patients leaving without being seen. Improvements in these metrics indicate greater patient access and more efficient patient flow. Quality will be monitored using hospital consumer assessment of healthcare providers and systems patient satisfaction scores, and 30-day hospital readmission rates. These nationally recognized measures evaluate patient experience and effectiveness of care transitions. Workforce performance will be assessed using registered nurse turnover rates. Lower turnover reflects stronger employee engagement, leadership effectiveness, and organizational stability. Financial performance will be evaluated by monitoring cost per case, allowing leadership to determine whether operational improvements are reducing unnecessary spending while maintaining quality. Finally, population health will be measured by tracking preventable hospital admissions. Declining admission rates suggest that community partnerships and preventive care initiatives are successfully improving health outcomes while reducing avoidable utilization. Combined, these performance indicators provide leadership with a balanced scorecard that supports data-driven decisions making and continuous quality improvement. St. Luke's University Health Network is well positioned to respond to today's healthcare challenges through strategic investments in teamwork, workforce development, and community partnerships. Together, these evidence-based recommendations address the organization's primary goals of improving access, enhancing quality, and controlling costs while supporting success under value-based purchasing and shared risk reimbursement models. Success will depend on continuous monitoring of key performance indicators, including emergency department wait times, patient satisfaction, readmissions, nurse turnover, cost per case, and preventable hospital admissions. Monitoring these measures will allow leadership to evaluate progress, make data-driven adjustments, and ensure the organization remains aligned with its strategic goals. By implementing these recommendations, St. Luke's can strengthen patient outcomes, improve workforce engagement, enhance financial sustainability, and continue fulfilling its mission of delivering high-quality, patient-centered care to the communities it serves.